Hi Trish, I'm Niamh Corduff. I'm a plastic surgeon based down in Geelong, but I also work up in Melbourne too. And my career has taken me now, as I'm getting older, into the injectable field, a non-surgical treatment of women's faces basically. And I work for industry and I train and lecture internationally, and I'm running research programs into it. So I sort of got into this into a very advanced level, which is incredibly exciting for me. Look, complications happen, even in the best of hands, in my hands too. And everybody who's honest will say, yes, I've seen there's problems. The training is absolutely essential. When you think about sticking a needle in somebody's face and injecting it, you've got to know what's underneath the skin, and you've got to have a feel for it. And I'm very lucky that I'm fully trained as a plastic surgeon, so I can automatically feel where my cannula or my needle is and know where the vessels are, where the nerves are, where the different layers and thicknesses are, how far down to the bone, etc. But for a lot of people, that can be a real struggle. So the level of training, the years of expertise is important. But the other thing is, if you want to look at what the results are like, the outcomes, just look at the staff in the clinic. You know, if you see somebody who looks like a transvestite sitting on the front desk, think twice, because it's about somebody's aesthetics. So the injector's aesthetics and what they see and what they perceive as important, and will indicate what goals they're trying to achieve or not trying to achieve. I have a philosophy which not everybody agrees with, but for me, I suppose because I'm getting on in age too, it's about not looking younger. It's about looking great for my age, or for our age. And that means looking healthy, looking well, looking strong, but looking age appropriate. And so that is basically, it's taking away the ugly side of aging, but learn to love your lines, learn to love your wrinkles. But if your skin is looking healthy, you will look radiant and look great and look strong. And if you take away the bits that make you look tired, make you look sad, make you look grumpy, grizzly, and that is because muscle balance changes and we lose bone and tissues slip and slide. And they give those expressions that aren't there. It's not what you're feeling, but it's what your face is saying. And if we can address those ugly bits, then that's what it's all about. You can start. Now, being very conservative, I'm not a great believer in saying injectables will prevent lines as you go along. I don't think that's a thing. I think the most thing is to look after your skin. When you're young, look after your skin. And that will be the biggest preventative you can. There are those who are born with deficiencies in bone, or have some, and you can really help those patients by correcting. So if they've got a very small chin, or cheeks are sitting back, or the nose is abnormal, you can actually use injectables wisely and sensibly to actually help and treat those areas. And that is, but you've really got to know your anatomy to do that and know what you're doing. Yeah, it's essential. Somebody who gets to know you, know what you want to achieve, what your priorities are, what your budgets are. All right, it's not just a money-grabbing exercise. You're a patient. So to work out a plan and work with that plan, change it if necessary. But yes, medical records and knowing exactly where you are, what you've had before, where and what you're trying to achieve, that's so important. And what works for you and what doesn't work for you. Every patient that I see has an individualized treatment plan. You know, and I see people and I say, okay, well, we'll start here, but this may not be right. We may need to tweak it and to work out exactly what is going to work for you. And then we know what works for you. It's having a knowledge and expertise in, yes, you've got skincare, and I keep banging on about skin, but skin is so important. So skincare, injectables that relax the muscles and address the balance of muscles, and also fillers, which can be, most of them would be hyaluronic acids, which we can reverse, or they're temporary, but some that actually stimulate long-term collagen production. And you're using those to fill in deficits where you've lost volume, or to lift tissues. So each product, you use your tools. It's like you're looking at somebody when you're operating, and you're using, you know, you've got all this armamentarium of tools, and you pick the ones that are going to get the job done that you particularly want in that particular area on that particular person. So it's having an expertise in all areas. So if you want to know more, look, you're very welcome to come and talk, and we can assess you and have a chat and see what your outcomes that you want. Drop us an email at inquiries@refine.com.au, or click on the link below this video. Yeah.